more transparency in return for fewer targets, learning and continuous improvement at the heart of a more human system where we eliminate any conflict between organisational priorities and what's right for the patient sitting in front of you. One litmus test of our commitment to this approach is 7-day care. This is not about increasing the total number of hours worked every week by any individual doctor. Doctors already work extremely hard, and their hours should always be within safe limits. But we will reform the consultant contract to remove the opt-out from weekend working for newly qualified hospital doctors. No doctors currently in service will be forced to move on to the new contracts, although we will end extortionate off-contract payments for those who continue to exercise their weekend opt-out. Every weekend, swathes of doctors go into the hospital to see their patients, driven by professionalism and goodwill, but in many cases with no thanks or recognition. The aim is to acknowledge that professionalism by putting their contributions on a formalised footing through a more patient and professionally oriented contract. And as a result of these changes, by the end of the Parliament, I expect the majority of hospital doctors to be on 7-day contracts. Around 6,000 people lose their lives every year because we don't have a proper 7-day service in hospitals. You are 15% more likely to die if you're admitted on a Sunday compared to being admitted on a Wednesday. No one could possibly say this was a system built around the needs of patients. And yet, when I pointed this out to the BMA, they told me to get real. I simply say to the Doctors' Union that I can give them 6,000 reasons why they, not I, need to get real on this. They are not remotely in touch with what their members actually believe. I have yet to meet a consultant who would be happy for their own family to be admitted on a weekend, or wouldn't prefer to get test results back more quickly for their own patients. Hospitals like Northumbria that have instituted 7-day working have seen staff morale transformed as a result. Timely consultant review when a patient is first admitted, access to key diagnostics, consultant-directed interventions, ongoing consultant review in high dependency areas, and proper assessment of mental health needs. I won't allow the BMA to be a roadblock to reforms that will save lives.